Hi all, I'm Adithya Gopan, first year Career Technology Department, SMS College of Allied Health and Science. Today, I'm going to discuss on the topic based on the article Leukemia. Leukemia is a cancer of the body, blood-forming tissue, including the bone marrow and the lymphatic system. Many types of leukemia exist. Some forms of leukemia are more common in children. Other forms of leukemia occurs mostly in adults. Leukemia usually involves the white blood cells. Your white blood cells are potent infection fighters. They normally grow and divide in an orderly way as your body needs them. But in people with leukemia, the bone marrow produces an excessive amount of abnormal white blood cells which don't function properly. Leukemia is a cancer of the blood characterized by the rapid growth of abnormal blood cells. This uncontrolled growth takes place in your bone marrow, where most of your body's blood is made. Leukemia cells are usually immature white blood cells. The term leukemia comes from the Greek word for white, leukos, and blood hema. Unlike the other cancers, leukemia doesn't generally form a mass that shows up imaging tests such as X-rays or CT scans. There are many types of leukemia. Some are more common in children while others are more common in adults. Treatment depends upon the type of leukemia and other factors. How leukemia causes? Science doesn't understand the exact cause of leukemia. It seems to develop from a combination of genetic and environmental factors. How leukemia forms? In general, leukemia is thought to occur when some blood cells acquire changes in their genetic material or DNA. A cell's DNA contains instructions that tells a cell what to do. Normally, the DNA tells the cells to grow at a set rate and to die at a set time. In leukemia, the mutation tells the blood cells to continue growing and dividing. When this happens, blood cell production becomes out of control. Over time, these abnormal cells can crowd out healthy blood cells in the bone marrow, leading to fewer healthy white blood cells, red blood cells, and platelets, causing the signs and symptoms of leukemia. Symptoms of leukemia. Symptoms depend in part on the type of leukemia. For instance, if you have chronic form of leukemia, you may not have noticeable symptoms in the early stages. Common signs and symptoms of leukemia includes fatigue, tiring easily, fever or night sweats, frequent infection, shortness of breath, pale skin, unexplained weight loss, bone or joint pain or tenderness, pain or full feeling under your ribs on the left side, swollen lymph nodes in your neck, underarm, groin or stomach, an enlarged spleen or liver. Bruising and bleeding easily includes nosebleeds, bleeding gums, a rash that look like tiny red spots on skin, or purplish or darkened skin patches. Types of leukemia. There are major types of leukemia. Includes acute lymphocytic leukemia (ALL). This is the most common type of leukemia in young children. ALL can also occur in adults. Acute myelogenous leukemia (AML) is a common type of leukemia. It occurs in children and adults. AML is the most common type of acute leukemia in adults. Chronic lymphocytic leukemia (CLL). With the CLL, the most common chronic adult leukemia, you may feel well for years without needing treatment. Chronic myelogenous leukemia (CML) typically affects older adults. It caused by chromosome mutation that occurs spontaneously. Risk factors regarding leukemia. Factors that may increase your risk of developing some types of leukemia includes previous cancer treatment, genetic disorders, exposure to certain chemicals, family history of leukemia, and smoking. How is leukemia diagnosed? Result from the routine blood work can alert your healthcare provider that you may have an acute or chronic form of leukemia that requires further testing, or they may recommend a workup if you have leukemia symptoms. Diagnostic exams and tests may include physical exam, complete blood count (CBC), blood cell examination, bone marrow biopsy or bone marrow aspiration. Imaging and other tests such as chest X-ray, CT scan or magnetic resonance imaging (MRI scan). And last, the lumbar puncture or the spinal tap. How leukemia is treated. The treatments of leukemia depends on the type of leukemia you have or your age, overall health, and if the term leukemia has spread that other organ or tissues. Common treatment often includes a combination of following: chemotherapy, immunotherapy, targeted therapy, radiation therapy, hematopoietic cell transplant or bone marrow transplant or stem cell transplant, chimeric antigen receptor or T cell therapy. These are the types that can treat or cure your leukemia. Thank you.